So hello and welcome to the June 2024 Michigan Vaccine Project webinar. June is Men's Health Month, so we have invited Dr. Meyerson and Mark Harris to talk about equity and disparities that may contribute to societal and/or psychological barriers to men's health. So let's start with introductions. My name is Alan Pilkington, and I will be the moderator for this webinar. I am the Educational Media Coordinator for MSU Extension's Children and Youth Institute, and I'm work out of the Kent County office in Grand Rapids, Michigan. So let's start with you, Dr. Meyerson. You want to go ahead and introduce yourself real quick?
Yeah, hi. Thanks, Alan. My name is Josh Meyerson. I'm a physician. I live in Petoskey, Michigan. I'm born and raised here in Michigan. I serve as the medical director for 3 local health departments that kind of cover a lot of the tip of the mid of northern Michigan, from Alpena over to Charlevoix and even into the Benzie, Leelanau area as well.
All right, so Mark, you want to go ahead and introduce yourself?
Yes, my name is Mark Harris. I live in Ypsilanti, Michigan, born and raised in Michigan. And I'm really into the men's health. I'm a fitness instructor. That was my beginning. And then I was diagnosed with prostate cancer in 2013. My son was diagnosed with different cancer 6 days later. He died 4 months later. So I've been kind of in this space helping men with their men and their families who have a prostate diagnosis, and also helping those who have lost a loved one. So I'm blessed to be here.
All right. Well, thank you both for being here. We're just going to start with questions. So the first question we have is, why are vaccinations important for men's health? And either one of you can chime in now.
Well, one thing I'd say is just, I think a lot of us just think about immunizations being something for kids, and it's not. And protecting ourselves against, we can protect ourselves against many infectious diseases, and that's really a lifelong project that can help keep all of us. It can keep men healthy and active throughout their lifespan.
Yeah, so I'm just going to echo what the doctor said. It's a lifelong process to be proactive. We're trying to get men, and I think the subject of this is to try to have men to be proactive instead of reactive when something happens. So let's do it before.
Right.
Yeah, great. So next question is, are vaccination rates different for men than women? And if so, how?
Yeah, I think maybe that's more directed towards me too. That I think in general, men kind of lag women in being up to date with a lot of recommended vaccines. It obviously can depend on what age group and what vaccines you're looking at. It can vary, but one example where men lag is the HPV vaccine, the human papillomavirus vaccine. It's recommended for all adolescents, not just women or girls, but for all of us. And really, it's also offered for adults routinely through age 26, and even for some adults up to age 45, depending on their circumstances. And I think because it first came out as a cervical cancer vaccine, that men have lagged behind women in being protected against the human papillomavirus, the HPV. But men are just at the same risk of getting cancers from HPV as women. There's a lot of cancers that affect men more than women that are due to this virus. And if we could get more men to be up to date with this vaccine, we could prevent thousands of cancers in men every year in this country.
Yeah, so it sounds like more education is needed for sure.
Yeah, that men should
and just
be
more
aware
awareness.
That they can be protected as well,
Yeah,
and they have risks.
Mm-hmm. All right. So next question is probably to you, Josh, again. What vaccinations are needed for men under age 50?
Yeah. Well, one thing I think most people, when they think of adult vaccines, they think of like tetanus vaccine, old tetanus boosters. And And for sure, the tetanus, and we call it Tdap now because the most common tetanus vaccine we use is TDAP that protects not just against tetanus, but also diphtheria and whooping cough. The P is pertussis. You need a booster every 10 years. And again, I think a lot of us know about that. But, there's the HPV vaccine that we just talked about. There's seasonal vaccines that, I recommend everyone get every year, like the influenza, the flu vaccine, and possibly an updated COVID vaccine. We'll see, what happens with that. And then, there's also vaccines that they may have had as a child, but they may not have. And if not, there's vaccines that offer protection for adults, like the hepatitis B vaccine, which is a virus that causes liver disease, hepatitis A, which is a very contagious virus that can cause liver disease as well. And then, some men have, some of us have very common health conditions like diabetes or kidney disease, asthma, lung disease, and other illnesses where they have other things that they can get to protect them, like the pneumococcal vaccine. Really, it's something, for a lot of men, especially if you do have some underlying risk factors or conditions, it's something that really depends on their circumstances. And that's where talking with their doctor or someone at the local health department can help them figure out what vaccines they can get to help them stay healthy.
I must admit, I'm one of those who are lagging as far as I'm gonna be truthful here. But in fact, if it wasn't, I had a prostatectomy in 2014, and I had to go and get basically all those shots and stuff. So basically, I'm more it was circumstances that made me be more up to date than I would have normally been. So I'm part of the choir that you're preaching to. So.
Oh, well, yeah, thanks, Mark. That's good. That's a great example too, that, when you do have a condition, then it's really even more important that you get up to date on those things.
Yes, yeah.
Yeah, for sure. I'm with you, Mark. I was lacking sometimes in my life, but I have good people around me helping me get to the doctor and do what I need to do. So
absolutely. I have mild asthma, and I'm going to admit it, and I live and breathe and teach and educate about immunizations. And it took me a few years to realize, like, oh yeah, I'm supposed to get a pneumococcal vaccine. And I think my doctor just figured I would have, I already knew all of that, so he didn't have to tell me that. And it took me a few years to realize that I was behind on what I needed as well.
All right, so we're going to move to the other side of 50. So are there specific vaccinations recommended for men over 50? So we did under 50, now we're talking about over 50.
Yeah. And for some of us that are over 50, maybe some here on this conversation, we don't like to think of ourselves as old and we're healthy and we take good care of ourselves. But, as we age, our immune systems just don't respond as well as they used to. In spite of what we might think, or even in our, taking care of ourselves as best as we can, our immune systems just don't respond like they do when we're adolescents and young men. The other thing is, as we age, we're more likely to have other conditions that put us at risk of vaccine preventable disease. Again, things like diabetes or lung disease or kidney disease, cancers and other conditions. Those are going to suppress your immune system. You're not going to be able to fight off infections as well as you'd like. So, for all of those reasons, it's even more important that we are protected with things like the annual flu vaccine. We should be up to date with our other vaccines like COVID, the pneumococcal or pneumonia vaccine. They're for older individuals. There's now a new vaccine, the RSV vaccine, that can protect against, again, another type of severe pneumonia that can affect older individuals. And then the shingles vaccine. I think hopefully a lot of our listeners have heard about the shingles vaccine. And, shingles is is kind of unique in that it doesn't prevent a new infection. Shingles is a reactivation of chickenpox. Most of us had chickenpox when we were younger and got over it, but that virus stays dormant in our body. And then when we are, stressed, our immune system isn't working that well. Maybe we're having to undergo treatment for cancer, or we're taking medications for other things, or just, again, as we age, shingles can be reactivated and you get a rash on your body that kind of looks like chickenpox, but it can be very, very painful. And I don't know if, anyone, people I know that have had it will tell you it's something you'd rather not have. It can be, painful at best, and can be very debilitating and last several months. So the vaccine is a 2-dose vaccine that routinely people over 50 can get. And it's very, very effective at reducing your risk of shingles, or especially the more severe type of painful neuropathic shingles.
So Josh, is the shingles vaccine just one time, right? I mean, I know you have to get it 2 vaccines because I have it,
It's
but
2 doses, but
and that's
at this
it.
point,
And you're
that's
good
it.
for
It's
life?
a lifetime thing.
Okay.
So you only need those 2.
Okay.
And
oh, sorry, go ahead.
well, I also I don't, tetanus is also one of those that I think it's good to mention, because the P in the Tdap in the tetanus shot is pertussis again, which is a whooping cough, which can cause a prolonged cough illness. People that have had it, adults generally get over it, but they can have this prolonged horrible cough that lasts months. So it's certainly no fun. But why we really worry about it is it can be really deadly to our youngest ones, to our infants, our newborns, and our babies. So I like to mention Tdap vaccine because this is one vaccine, for men. They may not think about their own health so much per se, but if you're going to be a new dad or a new uncle or a new granddad, this is you really want to make sure that you're up to date with your Tdap vaccine, because the last thing you'd want to do is spread what can be a deadly infection to the newest member of your family.
Yeah, see,
Right.
again, I just because of my surgery, I had to have all that stuff. I don't know if I would have had that stuff if it wasn't for my surgery. I'd like to say I would have, but I'm gonna be truthful. I probably wouldn't. Even though, well, I take that back. My wife is an epidemiologist, so she's so wives can be let's say helpful. They can be helpful. So
yeah, and I think if your wife or a daughter who's expecting, or someone, if they're asking you about have you had that whooping cough vaccine, they have a baby on the way there, then that's one of those, you need to do that for them.
yeah. No, that's it.
All right. So we got another one about vaccines, and I think that's the last one we're going to ask. So in addition to vaccinations, what tests do men need before or after 50? So what kind of tests do men need to get annually, yearly, whatever? Yeah.
Well, of course, now you're talking about prostate cancer, so you do your screenings then, you do your colonoscopy. Those are 2 that I really push. I'm sure your doctor has others.
Yeah, and those are both really important because they can help find cancer early when they're easily treatable. There's a lot of preventive services available to us that should be a part of your regular checkups. Just getting your blood pressure checked, your cholesterol, to find those silent problems that can lead to heart disease and stroke, and are easily treatable as well. Being screened for diabetes, of course, is a very common condition in our country, and is really important, especially for people who have family histories or risk factors for that. Mark talked about being screened for cancer. It's again, it's scary to think about those things, and I've had some friends say they'd rather not know about it. But the truth is, if you have them, you're going to find out eventually. So your choice is either, find them out early when you're healthy and you can manage them, or later on, when the damage has been done and treatment can be more difficult and you really, risk, your vitality and even your mortality.
Yeah. So
Yeah.
to
No, go ahead, Mark. Go ahead.
Besides what the doctor said, it's especially with cancer, it's all about early detection. It's all about early detection. So I had a guy 3 weeks ago tell me exactly that. I don't want to find out. Well, help me understand here. You want to duck your head in the sand and it goes away? I'm not understanding. So, it's all about early detection. So you get in there, and then I'm beginning to tell people, listen. So men are terrified about the DRE, the digital rectal exam. I say at least ask for blood draw. Ask for a blood draw, and then ask for a prostate, a PSA, prostate specific antigen. Ask for that because some physicians don't have that as a normal screen. So you may have to ask, okay, can I have a PSA? And it's just a blood draw. I'd rather you have that. And it's better. Yes, you're going to hear arguments about blah blah blah, all that kind of stuff. This is the best thing that we have right now. It's the best thing we have right now. Get a PSA and get your colon. And again, it took me a while to get my colon, but I had help. So again, but gentlemen, ladies and gentlemen, it's all about early detection. The earlier you get it, if they get on it early, find it early, it's a lot more treatable. And the treatment is usually simpler than if they catch it later on.
For sure. Yeah. So I can share a personal story. My mother died of colon cancer, and so my doctors always have known that since it was a long time ago. It was 25 years ago or 28 years ago, something like that. So yeah, I started getting colonoscopies early on, and I've had them every year. So yeah, it's really important for sure to make sure that you get those tests done. Yeah,
absolutely.
All right, so let's move on to why are men less likely than women to go to the doctor and get preventive care, like vaccinations? Does anybody have any insight into that? Why men are less likely?
Well, they're idiots, but no. Listen. If we can answer this question definitively, we would be super famous. So, but men, yeah, this is my opinion. This is my opinion. I've been doing this for a while, 10 years, at least 10 years, but really earlier than that. But about 5 months ago, I heard this statement, which I've always heard: women are much more proactive about their health. And so, and then the light just came on. If my mother is proactive and me as a daughter, I see what my mother's doing, I'm going to emulate what my mother's doing. On the other hand, as a son, I'm going to emulate what my father's doing. I'm going to emulate, and I'm going to emulate. I'm going to do what my father does more than what he says. My father doesn't talk about his health. I don't see him going. Now, he may go to the doctor, but I don't know about it. So I'm gonna have the same sorts of thing. And I think that's one of the things that I think that's a big thing, a major thing. Number two, I think because we don't have a conversation, women will talk about their health much more than men will. I've had very few conversations where I haven't initiated a health conversation, and I don't get the totality of what's going on. You got to drag it out of them. And so I think the machismo, and I really think the machismo, this male machismo, is a big part of this complicated reason why men don't do it.
Yeah. I agree, Mark. I think, it comes down, it's kind of our culture, and like you said, women often went, and started going to the doctor regularly, perhaps, during their pregnancy or for their quote annual exams. And the expectation was that that's something that was normal.
Yeah.
And men typically only went if they were so sick they couldn't make it to work that day.
Absolutely.
And that's a stereotype, but I think like you said, women are more likely to talk about it. They're more likely to have visits with doctors than men, and the more visits they have, the more likely they're going to get the needed preventive services and be proactive about their health, than when you're only going in when you're not feeling well.
Yeah, yeah. And I think I have taken it upon so I believe that God gave me experiences that I can help others with, and I don't mind talking about it. 'Cause I had a guy tell me about a month ago, Mark, I talk about cancer because you talk about cancer, I came to you, so if I have to be the piper, I'll do it. But we have to, because again, men are silos, they especially when things they don't want to, that they feel don't make them strong. So there's two things, the old men are strong and silent, but healthy is not part of being a man. So I'll act strong and be silent that I'm hurting, because I don't want you all to think I'm less than, but somehow we got to we got to have, as the doctor was saying, we have to make healthy being a common thing, a regular thing. We will want to, and we got to talk about that. Yeah.
Okay, so that's good stuff. Yeah, for sure. We need to, as men, be stronger. Yeah, but we also need some good people around us, which I think we've talked about that too. What barriers do men face in seeking medical attention, do you think? Both societal and maybe psychological barriers. What kind of barriers do you think men face in seeking medical attention?
Yeah, I think Mark already touched on some of those, in that, I think we don't always want to admit that we're getting older, that, that we're not invincible. Men, again, stereotyping, but a lot kind of hold things in. They're not maybe comfortable, admitting they need help, or that they, need to do those things. And so I think there are barriers to them, both in their kind of societal expectations and their internal expectations about being proactive about doing things to keep themselves healthy.
Dr. Meyerson has mentioned a couple of times, the stereotype. It's the truth.
Yeah.
That's not a stereotype.
Okay.
That's the truth. That's that. And that's where I've been doing this for, even before I started this kind of work in 1999 as part of a grant at U of M. So and I used to kind of be gentle and kind of a massage and everything. Now, no, because I have too many women who were, for instance, on my where I grew up, we're in an old neighborhood. My mother is the third one from the corner. So on the corner, if you went there about 15 years ago, 15, 20 years ago, Mrs. Jones was there. And all of these were married couples. Mrs. Jones was there. Next door, Mrs. Patton. Next door is my mother. Next door is Mrs. Thomas. Next door is Miss Johnson. Next door is Mrs. Next Johnson. Across the street is Mrs. Burns, Mrs. Hunter, Mrs. Brown, Mr. and Mrs. Williams, and Mrs. Ray. So out of six houses, there was only one couple, one male was still there. Out of six, or maybe eight, sorry. And all that's so, and I'm not sure, it's interesting. If you look at the leading causes, especially in African American, the leading cause of death, take the top diseases, like diabetes, and of course the doctor can correct me, but diabetes, cardiovascular diseases, hypertension, all these kind of things. Yeah. Black males are the leaders in almost all of those as far as the cause of death. They're leading, and men are leading. So it's not just color. It's men are usually the most dying from almost all the diseases. But yet and still we're not talking about that. we're not talking that's kind of alarming to me. But I'm alarmed by everything. So no, I'm just kidding. Health wise. Yeah.
All right, so I think maybe we kind of touched on this a little bit, but I'm just going to ask it anyways, just to see if there's a little more insight out of either one of you. So as men, would either of you be willing to talk about any barriers you have faced in getting healthcare and vaccinations? And what maybe you did to overcome it? Have you ever had any barrier against you?
No, I can say I have not.
Could you talk about any people, any of your people you work with, maybe that you thought maybe had
Well,
that?
so I'm going to be, and I've told many. I've worked with several professors and things who are in public health, but they talk about barriers. No, there's no barrier. That as far as I'm concerned, like for instance, my son, who had again, he had a different adenocarcinoma of the parotid gland, cancer of the saliva gland. He had no insurance. He was 31 years old. He was 30 years old, had no insurance. He ended up on Medicaid, and he had the same doctor I had. So I think it's more than people not taking advantage, because there's a lot of programs out here. But you got to go back to, I don't want to find out. So I'm not sure. If anything, the barrier is the man itself, not so much that they don't have access. In Michigan, we have all kinds of health systems. We're overrun. My daughter's out in Arizona, and when of course I'm here, and I'm trying to deal with her, and I realized how blessed we are here. I mean, we can basically toss something, and we're going to land on somebody's healthcare and health system. So we can, yeah. So I think the main barrier is that men are stopping themselves. That's what I would say.
Well, I'm glad to hear that you don't, that you're not having, where you live, that there is good access. I do think we do have wonderful healthcare community here, but I know especially in rural areas, access can be hard, especially for some men, if it can be difficult for them to get off work, and a day off work to travel to see a doctor means can mean less food on the table if they're the breadwinner in the family, and I think, like you said, sometimes that's psychological as well, but I think access certainly can be an issue, and I think to address those kind of psychological barriers perhaps that men have, that I think our healthcare systems can certainly work on ways to encourage and help more men feel comfortable talking about their healthcare issues. Maybe there's different approaches, different ways that they can have those conversations, because we know for a lot of men, we're just missing out on them. We're not connecting with them in that way. And certainly, it takes it takes two to tango. We need them to be willing, but I think we could do better at trying to engage, different sectors of our population to make sure that we connect with all of them, or as many as we can.
Yeah, just to follow up. Yeah, as I should have said, for me, yes, you're right, Dr. Meyerson. I'm on a couple of cancer when we review proposals. That's one of the things. Maybe they're out in the rural and they want to get 5 days of chemo and stuff. Well, if they live 2 hours away, 5 days, that doesn't make sense. So yes, and so I should have started off with with me. I can blindfold throw something in. I'm in a health system. So yeah, that's and I think and I think what some hospitals are doing, or some medical or the medical field, they're trying to get liaisons, like me, to go talk, because I think if they can see that just a normal man, I think a lot of people have been hearing from the doctors for so long, it becomes like Charlie Brown, wah, 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 wah. They can't hear what that person is saying. But if
Yeah.
somebody else comes and say, no, I am you, you need to do this. That will get people to move it in conjunction with the
Yeah,
yes.
I think that's great. I agree. I think as you can get more of their peers or people they look at that they look at as a peer, someone just like them or someone that they can connect with, it's going to really help get them into that system and help them make those proactive choices.
Absolutely. Absolutely. Absolutely.
Yeah, so that was good stuff. You kind of covered the next three questions. So I think I'm not even going to ask them because it sounds like barriers are not really there necessarily. And that, we just kind of got to be proactive and, we have a good healthcare system. So it's all about just getting people to recognize that they can get help if they need it. And
But okay, well, I do want to make it clear that Dr. Meyerson said, for some of them, the barriers are real. They're very, very real. I have to take off time. I don't.
Yeah.
Again, I bring everything. I'm in the cancer world, so if you need 5 days of treatment, a couple hours a day, I mean and it's a 2-hour drive, so that's 4 hours. You're missing that. That's a huge barrier.
right. Yeah. Or I had an uncle who he passed away sadly, but not from the cancer because he was treated, but he needed somebody he was retired. He needed somebody to take him to his cancer treatments because he couldn't, so like we kind of did a rotational thing where we would just go with him. So now here we are working adults who had to take time off of our day to go help him. But yeah, so there's definitely that too, for sure.
Absolutely.
So,
I'm
going to ask this question.
Dr. Meyerson had something else.
Oh, sorry.
Well, one other, I guess barrier, there can be financial barriers. And I think that's sometimes there's that perception. There are programs out there for people who perhaps don't have insurance, although certainly there can be financial issues for sure. When we're looking at a lot of these preventive things like vaccines, I think one thing that has changed over the years, and I think a lot of people don't know about, is that there's a lot of vaccines are now available through an adult vaccine program, so that if you don't have insurance that covers those costs, you can get them for no cost, either through certain physician offices, but also often at local health departments, and most insurances now, and this is different than how it used to be. I think we've made some advances there, is that insurances now cover a lot of preventive services, kind of what they call first dollar. There's no copay or deductible. You don't have to hit your deductible and spend all this money out of pocket. Those tests that are recommended, like the screening tests for cancer and vaccines, are covered fully 100%. So that can help people stay up to date with all of those things. And then, if they have difficulty getting into their doctor's office now, well, a lot of health departments and pharmacies offer vaccines for adults as well as some other screening services. And those might, those for people who have trouble getting time off work, they can get in there kind of on, different hours or even weekends to get the services that they need. And those aren't going to replace your doctor, but it can certainly supplement what you can get what you used to have to go to your doctor's office to get.
That's good information, Josh. Thanks, because I didn't know that existed. So that's pretty awesome that we have that kind of service for people who don't have
local health departments. When I started, we were just kind of doing, we did the only adult vaccines we really did was, we did flu and pneumonia, and we didn't see too many adults. But I think with the expansion of all of these different vaccines that we offer adults across that lifespan, we provide a lot of vaccines to a lot of adults, especially their physician offices may not want to deal with the hassle of ordering vaccine and refrigerating it. It's not something they know and do very well, and your local health department's a great resource for that.
Okay, so let's shift a little tiny bit. We might have kind of talked about this anyways, but I'll ask it. How can I talk to a man in my life about getting medical care who is resistant to seeing a doctor and getting vaccinated? What would you say?
Well, so this is what I do almost every day. I yell at them. No, I'm just kidding. You know, to me, well, and this is what I've I always start with what I'm doing. I always start with my story. I always start with my story because, again, I don't want it to seem like I'm a person of authority, because it seems like that's the last thing. Because again, they've heard so many there's so many people, so many people. I know this is a little bit different, but I with Dr. Brown out in Ipsy, she had a diabetes group, and so we started a program. You know, I went in there as an exercise person that was going to help them think. And so a guy told me, he was 435, I think, when we first started. He said, Mark, it took me 6 months to trust you because I've been hearing all of this stuff, what you're saying. But so what makes you, at the beginning, what makes you different? What makes you different? Because, you know, you're telling me I have bad eating habits, I have bad whatever. So he's heard all this negative things. And so when I put it, okay, but this is about your health. I didn't try to put it in a negative way, but it's, you know, but anyway, but he said it took me 6 months and so you have to you have to, number one, realize that they've heard the message that you're giving them. You have to realize they've heard this many times, especially, and the older they are, the more they've heard it. So you have to, and again, I don't know how you be trustworthy or going in with your glasses. Maybe that makes them you, but you have to get across. And again, I think because I was a person, I wasn't Dr. Brown. I was this outsider or this common man or this regular person. I think that helped, and I think so. And then you just have to me, you just have to be consistent with the message, consistent with the message, consistent with the message. You know, I have a men's walking group that I started in 2008, and then, you know, I'll have last week we had 3, and then this week we'll probably have 3 or 4, you know, or 2, you know, and you know, so but I'm just, and then one of my friends said, "Well, Mark, how can you what can you tell the men?" I said, "Well, listen, what can you tell the men? What can you give the men?" I said, "Listen, I tell them that you probably have a better quality of life if you exercise. You probably have a longer life if you exercise. So what do you want me to give them? Some money or breakfast or something?" But I know good and well, if I offer them breakfast, the place, or I'll say we'll have some drinks afterward, that place will be overrun with men. so, so I'm not doing it.
Yeah.
That's
Yeah. So
my
it sounds like, you know, time, consistency, those kind of things are, you just got to be consistent and keep
absolutely.
I think
pushing.
Mark really kind of hit it in that, you know, a lot of times, you know, it's setting that example, it's letting them know, you know, that what you do, you're making it the normal, you know, the normal choice, you know, and letting them know, hey, you know, I'm up to date with my vaccines. I got the pneumococcal shot because, you know, I want to stay healthy, and setting that example is probably better than getting into all the weeds and the statistics and the data and stuff. And another thing I think he said that, you know, he should be going on the road with this is that sometimes, you know, they may not want to listen to you the first time, and that's okay. But you don't just quit. You know, you keep telling them, you keep offering to have that conversation. And sometimes it takes us, you know, several opportunities before we can actually make that change in behavior. But it's okay. You know, if they're not interested the first time, you know, there's always that walk next week where you can bring it up again.
Absolutely, absolutely. Yeah, no, it's just I know, not the men again, not the men on this panel, but men could be stubborn, not the guys here or the ladies that you'll connect to. I'm not talking about you all, but so, but no, you just keep you just have to keep hammering, and like for instance, so I've been part of many diabetes programs. In fact, I did a program for MSU with Dr. Woody Neighbors. Um, and so but they'll say, well, Mark, you've been, my dad was a coach. My dad was a coach. And when I was 4 or 5 years old, I'm the oldest of five, but when I was 4 or 5 years old, I had to, make my bed, sweep the room, do the dishes, the chores. Everybody knows the chores here. I had to do 5 or 10 push-ups, 5 or 10 sit-ups, run around the backyard. Then I could go play. So I didn't know everybody had this built-in exercise. I didn't know that was just part of this because my dad was a coach. So now, so when I start a program, let's say I start a program, come in, I tell them that they say, well, Mark, you've been doing this all your life, which is true. I said, but listen, it's not like I put money in the bank and I get insurance. If I stop today and then 2 years from now you'll say, who's the big fat guy look just like Mark? I have to work out just like you. We're in the same boat. There's no difference. Now, yes, I'm a little bit ahead on the journey. So as we go around this bend on this mountain, I'll know there's a branch there, and I can tell you, watch out for the branch when you go around the bend. But that's it. I mean, I'm on the same path that you are exactly. There's no difference. Yes, I'm fit. Yes, I do it. Yes, but we're on the same exact path. I'm just a little further down the road. So that's why I make it very, very, very clear that no, I'm no different. But in fact, when I train people, I train with them. I don't stand around there. You do 5 push-ups, and I'll just sit here like I'm God's gift to exercise. No, I'm going to get down there with you, and I'll do it with you. And so I think I see it more as you're not even a liaison. I'm a partner with this because I want you. I think it's easier to bring you along if we walk side by side than if me lording over you. Not lording over you. Yeah, I want to set this example as Josh said.
All right. That was good stuff. I want you to be my trainer.
Yeah. Keep going.
All right, I'm
Careful what you
gonna
wish.
we got I think just one big question left, and then we'll do a little wrap up. So with so many years of experience for both of you as a practicing healthcare provider and patient advocate, from your perspective, how has the state of infectious and communicable diseases and vaccine utilization changed? That's really big. So you think over time, with all the years you've been both working in the healthcare field, has changed?
Well, first of all, you got just even COVID. COVID is new, so that's one major change. But I think science and of course Josh can expand on this. But I think because we have newer vaccinations than from 1960, 70, 80, whatever. So I think those are what I would point out too.
Yeah. Since I started, and again, vaccines kind of really something that were just for babies and kids before they went to kindergarten, starting school, but now it's something to think about across the lifespan. It's a great thing. We have, more vaccines to protect against more vaccine preventable diseases. The same thing with the screening tests and things where as we learn more, we hopefully are developing better ways to detect things and to treat them successfully. So, having that proactive approach can really, try to keep all of us healthy and living healthier lives.
For example, as Josh was saying, that just take cancer, prostate cancer. They used to get the PSA was the screen. Now they have what they call the PSMA PET, And that is, I have a friend who in 2020 was diagnosed with stage 4, stage 4 prostate cancer. I said before 2018, they would have probably gave you a year. Now he's still around because the PSMA PET, they're just the advancements on not just prostate cancer, on many things that used to be almost fatal are now almost treated as a chronic disease. There's a lot of different diseases because of the vaccinations and new screenings, and science is just better.
All right. So we're at the end. So I'm just going to ask one last little wrap up. What general health and vaccination advice would you each want to give to men? Do you have any last minute advice?
Well, mine would be just get your yearly exam. Please get your yearly exam, because again, the earlier you can find stuff, the better off the better off you'll be, and potentially your treatment will be easier earlier than later. So just a yearly exam would be and I'm gonna put a plug in. So at Ford Field, either in September or October, there's going to be a men's health event. There's $2,000 worth of screens for free. And we've had people from coming down from Flint and stuff, but it's free. It's given by MIU, but there's a lot of there's U of M, Carmanos, blah blah blah. So you can get almost everything checked, and it's free. You can get everything checked for free. So but do a yearly exam. I would start there.
All right. Yeah. And I'll echo that. I think, and Mark used that word proactive, but, sometimes, playing some offense is the best defense, and getting vaccines and getting all those recommended screenings, the things that you're going to be able to get or talk about with your doctor. If you get that annual exam, it's a way to be proactive about your health and preventing problems. I'm going to, jump on your bandwagon too, Mark. The one other piece of advice really is to stay active however you can. That exercise and staying active is really the perfect pill. If you want a pill to keep yourself to live a long, active, vital life, exercise is that pill. And there's probably not a better one out there. So as much as you can to just stay active.
Actually, I'm ashamed I didn't mention that. Yeah, that's why, and I tell people, so they say, Mark, you don't take, you're not because I'm 68 years old. You don't take medicine or anything. No, but now, ironically, I met Donald Trump, but I met his, my wife had a Congress down in Mar-a-Lago. This is in 2018, 17. And I met Trump's financial guy. But he was the old Trump's. He was not the new Trump. But he was saying, I go to exercise every day, and that's my pill. That my exercise is and I agree with him. In fact, I tell people, a friend of mine said, Mark, the insurance companies hate you because you're not using up anything. And I'm not, but I try to tell all my people, you do this, as Joshua said, you do this exercise, and I want you to work out. And I try to get them to work out hard because I want them to make a difference. Now, hard is going to be different from everybody. One time I asked a young lady, I said, I asked when I started that group I was telling you about with the diabetes group with Dr. Brown, I asked everybody, well, what did you do? Because I want people to think about that I've exercised. Oh, but all I did was go to the store. Well, you had to walk to the store, so so I want you to go home and get a blank sheet of paper and put, yesterday I walked. Don't worry about how much, we just walk. And then the more you do it, you probably start seeing benefits stuff, but give yourself credit. Give yourself credit. So I asked one lady, and young lady, she said, well, I just walked to the mailbox. And I said, because you said just, I can tell that wasn't just the thing. She said, well, last week I couldn't walk. Oh, well, again, that's a big deal. See, we're so busy because in our world, in our environment, in our society now, we're taught to compare and compete. Alan did 5 miles. I can't do 5 miles, so I'm not going to do anything. No. Alan do 5 miles because he been doing this for a while. No, so if you can do 20 yards or something, do the 20 yards. It's fine. That's fine. We're so much into what Josh is doing, what Alyssa, no. You do what you do and then grow from there. That's the key. That's the key. So that's what so that's going to look different as and so Dr. Meyerson was saying, it's going to look different for everybody, but don't just do something. Do something and then challenge yourself, do it again, do it again,
All right, that was a good wrap up. That was awesome. Thank you very much. So yeah, that concludes today. So thanks for both of you for joining us.